Every year, thousands of service dog handlers experience medical emergencies in public. It might be in a bustling city square, a quiet suburban park, or the middle of a crowded grocery store. For these individuals, their highly trained canine partner is their first line of defense, a living, breathing medical device. That's not rare. In fact, it's a reality that many handlers prepare for every single day. They have systems, training, and protocols in place. But there's one variable they can't always control: the public. And the difference between panic and a good outcome often comes down to what bystanders, people just like you, do in that critical first minute. Your actions can either support a well-rehearsed emergency plan or inadvertently derail it. Today, I'm breaking down exactly what to do when a service dog handler needs medical help. This isn't just about being a good Samaritan. It's about being an effective one. It's about supporting the person, understanding their needs even when they can't communicate them. It's about respecting the dog's job, recognizing it as a trained professional performing a life-saving task. And most importantly, it's about keeping everyone safe until professional help arrives. Here's the challenge. When a handler becomes incapacitated, maybe a seizure, fainting, a diabetic low, there's confusion fast. The human instinct is to rush in and help. People crowd in, alarms go off, the dog is working, and time feels like it's shrinking. In this moment of chaos, good intentions can lead to dangerous mistakes. Some folks try to pet the dog, thinking they're calming it down. Others try to move the person without assessing for injuries, and that can turn a tough situation into a dangerous one. The dog might be alerting, trying to signal the nature of the emergency. It might be blocking, creating a safe space around its person. Or it could be retrieving life-saving medication. But if we misread that, if we pull the dog away or block its path, we can interrupt the very help the handler set up in advance. Add noise, traffic, and bystanders filming, and the urgency spikes, increasing stress for both the handler and their working partner. So let's make it simple with a clear set of steps. This is your playbook for being a calm, effective ally. Step 1. Scan for safety. Before you do anything else, take 1 second and look around. Your first job is to prevent further harm. Look for immediate hazards. Is the handler in a traffic lane? At the top of a flight of stairs? Are they on scorching hot pavement? Are there sharp objects nearby? If there's immediate danger, your priority is to create a safe zone. Ask people firmly but politely to give space. Say, "Please step back, we need room." If needed, block traffic with your body, but only from a safe distance. Don't step into the road. Your safety matters too. The goal is to de-escalate the environment. A calm scene is safer for the handler, the dog, and the eventual first responders. Step 2. Check responsiveness. Now, try to communicate with the handler. Kneel down beside them and speak clearly. "My name is your name. Are you okay? Do you need help?" They may be disoriented but still able to communicate. If they respond and tell you what they need, like, "Get the juice in my bag," or "Just give me a minute," your job is to follow their instructions. They know their body best. If they're unresponsive, having a seizure, or clearly in severe distress, call your local emergency number right away. Don't hesitate. Tell the dispatcher, "A person is unresponsive with their service dog at location." Step 3. Let the service dog work. This is the most important and often the most misunderstood step. That dog is not a pet, it's a trained medical professional on duty. Do not pet, grab, call, or distract the dog in any way. Your attention can pull it away from its life-saving task. Many dogs wear patches like "Do not pet" or "In emergency, see tag." Look for a tag on the vest or collar with instructions. You can look quickly, but don't get in the dog's way to do it. If the dog brings you a bag, a pouch, or a laminated card, take it. This is a trained retrieve. It may contain medical information, emergency contacts, medication, or a care card with explicit instructions for this exact scenario. Step 4. Communicate clearly and calmly. Your voice can be a powerful tool for de-escalation. Talk to the handler even if they don't respond. Hearing is often the last sense to go. Use short, reassuring phrases. Help is on the way. Your dog is right here with you. I'm just giving you space. This can provide immense comfort. Pay attention to the dog's cues. If the dog is nudging you, pawing at you, or trying to lead you somewhere, follow their cue within reason. They are trained for specific tasks and may be trying to guide you to medication or an information card. Step 5. Only move the handler if they're in immediate danger. Moving someone incorrectly can cause spinal injuries or worsen their condition. Otherwise, keep them comfortable right where they are. Loosen any tight clothing around their neck, like a tie or scarf. If it's hot, try to shade them. If they are having a seizure, protect their head by placing something soft like a jacket underneath it. And a critical point, never put anything in their mouth during a seizure. This is a dangerous myth. Step 6. Crowd control. A chaotic crowd is counterproductive. You need to take charge calmly. Designate tasks. Point to one person and say, "You in the blue shirt, please call 911 and stay on the line with the dispatcher." Ask others to clear the space and keep things quiet. Say, "Everyone else, please give us room. We need to keep it calm for them and their dog." One calm, designated helper is far more effective than 10 people talking at once. This also prevents people from filming, which is a violation of the person's privacy. Step 7. Share information with responders. Your job isn't over when the sirens arrive. You are now a vital source of information. When professionals arrive, tell them what you observed. Be concise. They collapsed about 5 minutes ago. They were unresponsive. The dog brought me this medical pouch. Hand over any medical card or bag the dog provided. Keep the dog with the handler unless responders specifically direct otherwise. The dog is part of the medical team, and its presence can be crucial for the handler's stability and recovery. Let's see how this works in a real-world scenario. Imagine a handler in a grocery aisle goes pale and collapses from a diabetic emergency. A bystander sees this. Do. Scan for safety. The aisle is clear. Don't. Rush in and try to lift the handler. The dog immediately braces its body to prevent injury from the fall, then grabs a red pouch from the cart and nudges the nearest adult. The bystander takes the pouch. Inside, a tube of glucose gel, a medical card, and a simple instruction. If unresponsive or slurring, call 911 and apply gel inside cheek. The bystander has another person call 911 while they administer the gel, following the instructions perfectly. That is a successful intervention. Now consider a different scenario, a panic attack in a public plaza. The handler is sitting, hyperventilating, and their dog is performing deep pressure therapy by lying across their lap. Do. Give them space and quietly ask from a distance, "Are you okay? Can I get you some water?" Don't. Rush over and try to pet the dog or touch the handler. Your presence could escalate their anxiety. Respect the space the dog is creating, or an asthma attack on a bus. The handler is struggling to breathe. Their dog might bark once to get attention, then nudge a backpack under the seat. Do. Notice the dog's cue. Retrieve the bag and hand it to the handler. Don't. Yell for the driver to stop the bus immediately, causing panic. Let the trained team attempt to resolve the issue first. If they can't, then escalate. A few quick legal and etiquette notes. Under laws like the ADA, a service dog is medical equipment. You must not separate the dog from the handler. Never ask for proof or certification for the dog. It's illegal and inappropriate. And unless you are asked to document the scene for responders, do not film. This is a medical emergency, not a spectacle. After the incident, once paramedics have taken over, your role shifts. Give them space to work. If you were the primary helper, stay nearby in case they have more questions. Make sure any of the handler's personal items, like a phone or wallet, are given to the responders. The service dog will almost always accompany the handler in the ambulance. Your job here is done. You can leave knowing you helped effectively and respectfully. Let's do a final 60-second recap. If you see a service dog handler in distress, remember this checklist. 1. Scan the area for immediate dangers. 2. Check if the handler is responsive. If not, call for emergency help. 3. Do not distract the service dog. Let it do its job. 4. Look for instructions on a vest tag or take what the dog brings you. 5. Communicate calmly with the handler and the crowd. 6. Only move the person if they are in harm's way. 7. Give a clear, concise report to first responders. By following these steps, you transform from a bystander into a crucial part of a life-saving team. You provide the bridge of safety and support that every service dog handler hopes for in a moment of crisis.